Mike and Erica, thank you so much. That was a brilliant presentation. And thank you for starting this registry and spending this last half hour telling our patients. I think you did it in such a wonderful way that was really clear and eloquent. Whether you're a physician like me or if you're a patient with IBD, it was really understandable. And a lot of what you said really resonated with me. I remember on March 11th, the WHO announcing this as a global pandemic and realizing, whoa, the world is going to change. And that would let us actually to strike Crohn's and Colitis Canada's national COVID and IBD task force that Eric and I co-chair with gastroenterologist scientists across the country. And when we first started thinking about the problems that we were going to be facing for our patients, we had no data. Everything that we were doing was all based on extrapolation. Most of the COVID cases were coming from Asia, where the rates of IBD were very low. And so there wasn't any kind of clues for us to go for. But at the same time, we had to make recommendations, and we extrapolated, and we nationally got together, and then many of us were part of international groups that spoke, and we set a series of recommendations that were based on extrapolations. And I'll give you one example, and I think it was somebody in the audience asked, why is prednisone makes things serious and puts you at a higher risk group? Well, what happened was in Asia, there was a group that tried to treat people who were very sick with COVID with prednisone as a treatment, because we saw that in their lungs, people who developed the viral pneumonia, many of them were succumbing to a hyperinflammatory response in their lungs, less so than the virus actually attacking the lung. But when they tried with prednisone, those patients got worse compared to those that they didn't give prednisone. And that data, again, wasn't studied in IBD, but it led us to say that if you're on prednisone, you're likely going to be considered a high-risk group. And now, weeks later, you develop this registry, and you're now starting to give us some preliminary snapshots of 700 patients who have IBD and are COVID positive. And some of the guidance that we've given, and I think Eric, you'd mentioned this during your talk on reviewing the recommendations. It is reassuring that what we were saying is reflected in the data. So I just wanted to start by kind of sharing that with the audience. And again, thanking you for your great presentation.
Yeah, no, thank you very much, Mike and Erica. I really appreciate it as well. And maybe I'll start us off with a question. You mentioned how the idea came up through the story of a patient's parent calling you and saying, what are you going to do about this? Which is a fantastic way to get research started. It happens really very often that the ideas come from our interaction with patients, but this is particularly because you got it together so quickly. But I'm fascinated by the fact that you were collaborating with gastroenterologists in New York City, at the Icahn School of Medicine, Mount Sinai. What was that like, sort of starting that collaboration and then watching as New York City became the epicenter of COVID-19 in the world, really?
I'm happy to start off, Eric, if you don't mind. Again, the COVID thing has really struck me as something that brings out the best in everyone. And it was one of these situations where everyone wanted to work together, to learn together, to collaborate, rather than sort of rush and do it yourself. We had started the planning of this. I had discussed this with a friend. Simultaneously, the Mount Sinai group, because they were in the epicenter of all of this, had started doing some planning and preliminary discussions. They spoke to the same friend. That person put us together. Right around the same time, an international organization, the International Organization for the Study of Inflammatory Bowel Disease, was also talking about how can we make this a global worldwide epic. A global worldwide collaboration, and everything just came together literally in about an hour. Yes, let's all work together. Let's have our team join forces with the Mount Sinai team. Let's harness international collaboration rather than having every country or every hospital do its own thing. Let's have one registry, and let's make sure that we can do this as quickly and as efficiently as possible.
And I understand you're also collaborating with there's a pediatric registry that's going on as well in Europe, right? Run by Dan Turner. You're collaborating a little bit with him as well?
Absolutely. So again, it was the exact same thing where Dr. Turner reached out to me, within a couple of hours and said, "Listen, I've already got a multi-center group together in Europe. We've been collaborating on a number of projects. We don't want to interfere with SECURE-IBD. Let's sort of compare notes. Let's harmonize our data collection forms." And in fact, every several weeks, Dr. Turner and their group sends us a update of what they've learned in their reported cases. We include them on those cases, a summary of those cases on our website as well, so that the entire world can see what has been reported there as well. And in our very first manuscript that we submitted for publication, we pulled together the 6 reported cases in that European pediatric group with the several hundred cases in SECURE-IBD. So again, it really has been a worldwide, highly collaborative effort.
I think that's.
Sorry, I was just going to say, Erica, you're a pediatric GI fellow. So I mean, you've had your years and years of training, but I'm just kind of curious, how did you get involved? And how is this, as being a trainee, being involved in such an international registry? What's that been like?
Yeah, so Mike must have gotten woken up at 3 in the morning on a Wednesday, because I very distinctly remember that he reached out to me on a Thursday with a quote unquote game changer idea, something that would actually allow us to make a difference in what has been a pretty tough time. So as soon as he came and sat down at my office and told me about it, I was really excited. And I think Mike said, I feel like we're living in dog years, because it has truly been lightning speed from Mike sitting down, talking to me about this idea, and us brainstorming and then collaborating with Ryan and Jean-Frederic in New York City, and then actually getting this website and this database off the ground. It's all happened very rapidly, and it has been such a steep learning curve for me. It's been truly amazing, and the very smart people that I have worked with and learned from over the past month has just really been incredible for me. So I am honored to not feel useless during this time, to feel like I'm making a difference and able to help my patients. And I am certainly learning a lot along the way.
And I think the message that we're hoping to send to the audience, and that you've sent to the audience, is a positive one, right? That people really are stepping up and working together and doing everything that they can to help people, help patients with IBD, and then help even people who don't have IBD prevent getting COVID. And scientists around the world, clinicians around the world, physicians, nurses are all working together to try to beat this. Sometimes we don't always get that message if we watch the news on a regular basis. We hear about people working against each other. That's not the reality in the medical world or the science world right now, I think.